Hi everybody. Today's lecture is going to be on blood and blood vessel anatomy. And let's go ahead and get started with some of the main functions of blood. Blood is essential in terms of transporting majority of the nutrients and the gases required for survival. These nutrients include glucose, amino acid, fats, vitamins, etc. You also have your hormones being transported, metabolic waste, which are identified as urea and uric acid, and of course the gases, which are your oxygen and carbon dioxide. Your blood is also responsible for maintaining your pH. The way it does that, it uses a specific molecule called bicarbonate. And bicarbonate is written as HCO3 negative, and this is helping you maintain your blood pH at the magic number of 7.35 to 7.45 for your blood pH. It also allows the body to restrict fluid loss during the site of injury by creating blood clots. They are responsible for fighting up against infections by creating, and by not necessarily creating, by having plasma antibodies that can mark and destroy pathogens. And lastly, blood is also responsible for helping you regulate your body temperature with the help of your blood vessels. So for instance, if you are basically hot, the symptoms or the what you would observe is you turning red or get flushed through the process of blood vessel dilation, bringing more blood to the surface of the skin, allowing that to be radiated, allowing the heat to be radiated. Versus when you're cold, you will appear more pale because the blood vessels in your skin are vasoconstricting, which limits the blood supply to the skin, and again, limiting the heat loss through radiation. Now, if you compare the blood volume in male versus females, males do have in average about 1 liter of blood more than women, so about 5 to 6 for men versus 4 to 5 for women. The reason that contributes to that extra blood is the hormone testosterone. And the reason behind it is that because men typically have a higher muscle mass, and therefore that extra muscle mass requires a higher level of blood to supply the nutrients and oxygen. When you look at the composition of the blood, you have what we identify as the cellular components, also known as the formed elements, which are basically your white blood cells, red blood cells, and plasma. And then you have the liquid portion, which basically give your blood the fluidity, also referred to as the plasma. So in this picture, what you can see labeled, you can see the formed elements. Erythrocytes, as we will learn, is basically your RBC. Platelets are the ones that are basically responsible for blood clotting, and then monocyte is one of the 5 major types of white blood cells, which are basically responsible for our defense. And you can see the other types of white blood cells labeled down here. So if you take a sample of blood, doesn't matter again, male or female, and you spin that sample using a machine called centrifuge, you can separate the blood based on its components and the density and the heaviness of those components. And as a result, you can create 3 separate layers. The lightest layer, or least heavy layer, is the plasma. And as we can learn, the reason it's so light is because it's mostly made up of water. You have plasma making about 55% of the whole blood. You have a very thin layer, typically about less than 1%, called the Buffy coat, which includes the leukocytes and platelets. Leukocytes is another way of saying white blood cells. And the remaining of your whole blood would be your red blood cells, or your erythrocytes, which are about 45%. And this 45% is referred to as the hematocrit. So hematocrit is, again, percentage of red blood cells in the total blood volume. Now again, notice that in males, the number runs about 5% higher compared to females, going back to what we mentioned earlier. So what is plasma made up of? Plasma is basically kind of a sticky fluid portion of the blood. It has a tinge of yellow to it, is the best way to describe it. It is mostly made up of water, which is logical again, because that's what makes your blood basically fluid, right? And the remaining 10% contains ions. And again, examples of ions would be things like sodium, potassium, calcium, etc. Nutrients would be things like your glucose, amino acids, fats, and waste product could be things like urea or uric acid. Again, I'm just giving you some examples. It doesn't include everything. And then proteins. Now, there are quite a few different types of proteins in your blood, but you can say the majority of the protein falls within these three categories: albumin, globulin, and fibrinogen. Albumin is the most common type of proteins you have in the plasma. It is produced by your liver, which is a typical exam question. Again, kind of think about it. Plasma is mostly made up of water. You can't make proteins out of water. So these proteins have to be made somewhere, and your liver is going to be responsible for that. And what they do is they create something called osmotic pressure. So osmotic pressure is important because it makes sure or ensures that water stays where? It stays in blood, not leak into the tissue. So kind of imagine if you have this 90% of this portion is water, and imagine this water start to leak into the tissue. So here's my blood vessels, here is my blood vessel, and here's my tissue, right? By having albumin here, this water, your water stays inside your blood vessels rather than leaking into your tissue. So keep in mind that if somebody has liver disease, the concentration of this protein albumin goes down, which basically means the water will leak into the tissue and causes what we identify as edema. So if you have liver, typically, and again, this doesn't always happen, but if you have some sort of liver disease, what happens again? You'd have a decrease in your albumin concentration, which means that, water is going to leak into your tissue because the osmotic pressure decreases, and that causes edema, which is basically your tissue swelling. The second protein you have in common, which is about a little bit over 35%, is globulin. This is the one that is usually acts as a transporter, transporting vitamins, metals, ions, lipids within your bloodstream, and sometimes also act as antibodies. And again, you will look into, when you go to take physiology next semester, you take a more in-depth analysis of this for lymphatic system. And then fibrinogen, which is the least common one, it's about 4%, is the one that is associated with blood clotting. Now, again, notice the keyword here for these three is that they're all associated with your liver. Now, looking down into the next two levels, which is your buffycoat, the tiny one, and then your hematocrit or your erythrocytes. And the buffycoat, again, is made up of your white blood cells and platelets. And the remaining blood, which is about average about 45%, is going to be your red blood cells. So, red blood cells, what do we need to know about them? First of all, know that it's also called, again, erythrocytes. They are relatively small, so they're about 7.5 micrometers or microns in diameter, which basically means they are small. Again, I'm not going to talk about the units and what those mean, but understand that are, in terms of cells, they are on the smaller side. Again, going back to that whole concept of male having more blood, that also translates in terms of red blood cell numbers. So in females, you have about 4.3 to 5.2 million cells per cubic millimeter, which is a way for measuring the RBC count. And in males, it's about 5.2 to 5.8 million cells per cubic meter. So cubic millimeters. A very key characteristic of your red blood cells is that they lack organelles and nuclei. So basically, if you take a look at this red blood cell and burst it open, it does not have no organelles, no nuclei. Organelles, if you guys recall, some of them was like endoplasmic reticulum, like your rough ER and the smooth ER, your Golgi, your ribosomes, right? You have, and etc. Again, I'm not going to list every organelle we have. But why is this important? This basically means that your RBC can't repair itself. So if it cannot repair itself, it has a relatively short lifespan of about 100 to 120 days. Again, because it cannot repair itself if there is some sort of damage. So cells will not, if you continuously use them, and if you cannot replace or fix the damage, those cells are going to be destroyed. Now, why do I take out all of these organelles out of my cell? Why do I take out the nuclei and the organelles out of the cell? Because I want to use as much as the space available to pack it with a protein called hemoglobin. We usually shorthand hemoglobin to HB. And why do I need that hemoglobin? Because it's the main function of that is to carry oxygen for my cells. The other characteristic that you can see is that red blood cells identify as biconcave, as in basically has two curvatures. It's kind of look like a donut without the hole completely going at the center. Why is that important? It increases the surface area by 30%, which means a more effective gas exchange. So again, we already talked about the fact that they are relatively short lifespan. And if I ask you, where are these red blood cells actually coming from? They're coming from your bone marrow, more specifically your red bone marrow, which should sound familiar to you guys since we already talked about the skeletal system. And red bone marrow are located typically in your spongy bone. Here is a different depiction of your red blood cells. So you have the typical light microscopy picture. So everything you see, these are identified as your RBC. And again, you can see they are very frequent. Here is a depiction of your red blood cells within a capillary network. So again, you can see them lining up basically. Here is kind of a zoom-in version of what we showed you earlier. And again, you can see that it says the diameter of the red blood cells is in average about 7 micrometer. Now, we have mentioned earlier that your red blood cells are packed with hemoglobin. Now, when we say packed with hemoglobin, what are the numbers? In one of these red blood cells that I showed you here, one of these cells you see right here, if I look at it at the basically cell or microscopic level, or molecular level, I should say, you will have 250 million hemoglobin proteins wrapped within these tiny red blood cells. Pretty large number. So what does the hemoglobins actually look like? So the way we depict it is you have 4 structures of protein. So here is one, and you can see the color differences. They're almost all identical to each other. They're 2 pairs. So these larger purple structure you see here, they're called globin. There are 2 of them that are identified as alphas. So this one and this one are your alphas, and this one and this one are your betas. The second unit that you have is the heme, which is this yellow circle or disc you see right here, or orangish disc, I guess I should say. So there's 4 of them here. You may have a hard time seeing all 4 of them, but they are like there. This is basically the red pigment, which basically make your red blood cells red. And then iron, which is these tiny dots at the center, these are your iron. And again, there are 4 of these. And these irons at the center of the heme bind to individual oxygen molecule. So here, if I have 4 irons, basically I have the capacity to carry 4 oxygen molecules. Now I'm gonna do a quick drawing for you guys in terms of what it looks like, a simplified version with a little bit more detail. So if I have, again, kind of depicting the same concept we did, and these 4 circles are almost the same size. So these 2 are my alpha globin. These 2 are my beta globins. One of the main functions of either alpha or beta globins is to carry CO2. These are the protein subunits. So when you talk about proteins, this is the protein component. These are what amino acids, basically made up of amino acids. Now, at the center of each of these circles, I will have another structure. Again, each of these will be identified as a heme, which basically, again, is my red pigment. And at the center of each of these, I will have one single iron. And why do I care about iron, which is shorthand to Fe? Iron is responsible for carrying O2 or oxygen gas. So if this is one hemoglobin, it carries how many? It carries 4 O2 molecule because it has what? Because it has 4 iron at the center of its heme. Now recall, guys, in one red blood cell, I have 250 million hemoglobin, and each of these hemoglobins carry what? 4 O2. So one red blood cell has 250 million, right? Times 4 for oxygen, which adds up to 1 billion O2 per red blood cell, which is huge if you think about it. So if you go back to this picture, this tiny cell that I've drawn, if it's fully oxygenated, it carries 1 billion O2 molecule. Now, we already talked about the fact that the red blood cell lifespan is short, it's about 100 to 120 days. Again, highlight this, guys. No nucleus, no organelle, right? That's the main reason. Basically can't repair, right? I'm gonna kind of reinforce this idea. So what happens when you destroy your red blood cells after their lifespan is done? So think about this, guys. Again, going back to the drawing that I did for you guys. We have the heme, the globin, and the iron. So heme is basically going to be the red pigment, right? Again, I'm gonna kind of going back at this. You really need to kind of understand each component, which makes it easier how your body destroys them. Red pigment is gonna eventually, through a process, degrade to what we identify as bilirubin, which usually has a yellowish color to it. This bilirubin gets picked up by the albumin of the liver, right? So your liver has a main function in terms of destruction of your red blood cell. And it transports these bilirubin, these unwanted molecules are basically waste products, and transport them through the digestive system, and eventually allows these bilirubins to be excreted as part of the fecal matters. So part of the coloring that comes in a fecal matter comes from your body excreting and removing bilirubin from the destroyed red blood cells. Globin, remember I mentioned earlier, globin is basically the protein, right? Or the subunit, protein subunit, which basically means that this is made up of amino acid. So when your red blood cells destroyed, which means it's destroying its hemoglobin, you're gonna break the globin portion to the amino acids, and the amino acid basically gonna be recycled to make new proteins. Understand that you brought this amino acid by eating proteins, right? It doesn't matter what your protein source was. So just because you're destroying the red blood cell, that doesn't mean your body is going to get rid of the amino acid. That's a very ineffective way of using these. So all you do is, again, kind of think about that whole concept of Lego, right? You build a building, you're done with that. You're not going to take the whole building and throw it in trash, right? What do? The Lego building comes into individual Lego pieces, and then you can reuse them to make something new, which is your new protein. Same concept applies to iron. I don't want to get rid of it, right? Because kind of imagine this before even we go farther than this. Every time you destroy a red blood cell, you need to replace that red blood cell. Otherwise, you're going to be having shortage of red blood cells, which is known as anemia. So if I'm basically doing and destroying about 2 million red blood cells per second, if I need to basically stay healthy, I need to replace those 2 million destroyed red blood cells with 2 million new red blood cells. Those new red blood cells also require iron. So I can basically take the iron from the destroyed red blood cells and use them to produce new red blood cells. So iron can be stored in your liver for reuse, or, and it's depicted here for you guys so you can review it as well, that iron can also go back and transport it to your bone marrow, which is the location for what? Red blood cell formation. And basically, again, you're recycling your iron component. Here is the same thing if you want to look at the other components. So your red blood cells comes in, gets destroyed. The amino acid can be recycled to produce new red blood cells, or it can basically be used for other protein synthesis. The heme, which is the red portion of the red pigment, eventually gets broken to bilirubin, transported to the liver, goes through your digestive system, and eventually excreted. Please do note that in this picture, we're also depicting kidney. Some of the bilirubin also goes to the kidney and gets removed as part of urine because it is identified as the waste product. Now, looking at your third layer that we have inside your spin blood sample, we had, again, kind of showing you, highlighting the same thing. You had your red blood cells. You have a very tiny layer, which we call the buffy coat, right? And then the top layer was the plasma. So we talked about the plasma, we talked about the red blood cells. So now we're gonna talk about the buffy coat. So buffy coat, as you can see here, is made up of platelets and your leukocytes, which are, again, leukocyte basically means your white blood cells. Now, within this little tiny layer of less than 1%, you have 5 main categories of white blood cells. These are neutrophils, basophils, lymphocytes, and monocytes. One way for us to classify these white blood cells is by looking for the presence of granulocytes. Granulocytes are basically, if I look at the cell, this is my cell, if I see a bunch of dots, which are basically tiny vesicles inside my cell, these cells are granulocytes. If the cytoplasm of the cells are relatively clean, that means those cells are agranulocytes. So here's a depiction of the 5 different types. So let's look at them in a little bit more detail. So leukocytes, which are also your white blood cells again, really low concentration compared to thinking about your red blood cells being in millions, right? Your white blood cells are pretty low in concentration. But they do play a major role in terms of protection of your body against any type of infectious agents. Again, typical one would be your bacteria or viruses. You also have parasites. Parasites is another good one. They can come out of the bloodstream as they circulate, go to your tissue, and that process called diapedesis, basically leaving your white blood cells leaving the capillaries and go to the site they needed. And again, as I mentioned, there are two different types: granulocytes, which are basically have granulites or vesicles inside the cell. They can be stained, versus agranulocytes, where these vesicles are not visualized, or they have low concentration of these vesicles. Now, one way to classify or look at the white blood cells is based on their frequency. So how many do I see, basically? And if you ever wonder, like, you're reading this sentence and you're like, what is this about? So look, never let monkey eat banana. Neutrophils, lymphocytes, monocytes, eosinophils, and basophils. These are the highest frequency, these are the lowest frequency. And basically they decrease as we go from the never all the way to the banana, quote unquote. Now, I don't want you guys to know the particular percentages. That's a little bit beyond the anatomical aspect of this class. But I do want you guys to know the frequency in terms of what is the order. So neutrophils all the way to basophils, you do need to know the proper order. Now, let's briefly look at each of these categories of white blood cells and associate some of the main functions with them. So neutrophils are the most frequent type of white blood cells. They range in about 70-ish%. And again, it can be a little bit lower, a little bit higher. Their job is to phagocyte and destroy bacteria. Basically, phagocytosis means they eat them. They can migrate very rapidly to the site of infection. So they're one of the first cells that are present themselves at the site of infection. And they have high concentration of lysosome. If you guys recall this, this basically means they have a rich digestive enzyme. And again, this is I just noticed that. Digestive enzyme basically that can break down unwanted material. One way to classify these neutrophils is they can have the nuclei that expand from 2 to 6 lobes. So if you look at this purple structure within my cell, this is the boundary of the cell. And look, it has 1, 2, 3, 4, and 5 lobes in this one. So this doesn't mean it has 5 nuclei. It's still one nuclei, but it has lobed, or it forms a smaller lobes to form the larger structure. Typically, if you're looking at the staining of the granulocytes or the vesicles inside, they do pick up what we identify as both acidic and basic stain. So they have kind of a light pinkish granules inside, and you can kind of depict them right here. What we identify as pus is typically identified as what gets released after the bacteria have been destroyed. This is basically the pus that gets released, again, quote unquote, is basically neutrophils that have been fighting the infections and might have been damaged and are destroyed themselves. Other types of leukocytes, as well as the damaged or scarred tissue, as well as the dead bacteria debris that was destroyed by your white blood cells. Now, another granulocyte classification is eosinophils. Eosinophils are the second least common type of white blood cells we have. So they're about 1 to 4% of your white blood cells, again, relatively low. The most important role they play is they are essential in ending your allergic reactions. So basically what they do is degradation of what we identify as histones, which are basically trigger your allergic response. So basically they stop it by degrading or breaking down these histone molecules. They also have an extremely important role in fighting parasitic infections. They do go attach themselves to the parasite and basically release material into the environment that can cause the destruction of these parasites. So because the parasitic infections are usually localized to the digestive tube or digestive system, you can find them in digestive system at a higher concentration. And again, they would basically, if you see a spike in a blood test for eosinophils, that typically implies that the person has a parasitic infection. The third classification of granulocytes are basophils. So basophils are the least common. So they are less than 0.5% in terms of number, which means if I count 100 white blood cells, less than one will be visible. So basically you need to count more than 100 white blood cells for you to be able to pick one basophil. Again, really, really uncommon. What's the best characteristic? Their nuclei is usually 2 lobes, and you can see they have very significant dark purple staining for their granulocytes. So again, it's even hard to pick up where your nucleus is because the background where your granules are really dark purple as well. Why do I have basophils? What's the main function? They create what we identify as an inflammatory response or your allergic reaction as a result of releasing histone into your bloodstream. So basically, basophils trigger the immune response, and eosinophils end the allergic response, and eosinophils end the allergic response. Now, these next two categories are identified as agranulocytes because they lack very pronounced granulocytes inside their cytoplasm through the staining process. So one of these agranulocytes are your lymphocytes. Lymphocytes have two main categories. You may have heard of these, B cells and T cells. So they also can be called B lymphocytes or T lymphocytes. What is their most important job? Is they have a very important role in terms of immune system, and not just any immunity. They create a very specific immune response. And this is the one that basically allows you to create memory in terms of identifying the infection, triggering immune response, production of antibodies, targeting viral infected cells, etc. These are going to be the most essential cells in terms of creating a very strong immune response. And again, the two main categories will be B cells and T cells. The next category of the white blood cells we have is monocytes. Monocytes are relatively uncommon, but again, not as uncommon as eosinophils and basophils. So they're about 4 to 8%. They have a very pronounced U-shaped or bean-shaped nuclei. You can see that here, basically. Here's the nuclei. They are the largest type of white blood cells we have among the 5 categories we have described. And their main job is, again, phagocytic cells, as in they're going to eat up bacteria or infective agents that are present in our environment. They still do have a lot of lysosomes, so they are very similar in terms of a structure to neutrophils, but when you do the staining of the acidic basic stain, you won't see much coloring happening inside your nucleus, inside your cytoplasm. Now, when we were talking earlier, we mentioned that your red blood cells, you would destroy about 2 million red blood cells per second. And we said that these red blood cells can be replaced at the same rate, otherwise you will develop anemia, which basically means low red blood cell count. So blood cell formation in general, doesn't matter, it doesn't have to be red blood cells, but in general, blood cell production process is referred to as hematopoiesis. We already discussed that it takes place inside your red bone marrow, which is located within the spongy bone. And in average, you make about 100 billion new blood cells a day, which is huge. Kind of wrap your head around that. Now, regardless of if they're white blood cells or red blood cells, they are originating from the bone marrow. However, they have two types of bone blood cells that they can originate from, or blood stem cells they can originate from. One that's called lymphoid and the other one's called myeloid. Now, look at the name, guys. Lymphoid should automatically remind you of lymphocytes, the B cells, T cells we mentioned earlier. So, the only category of cells that are going to be created created through your lymphoid stem cells would be your lymphocytes. All other blood types, which include your red blood cells, your neutrophils, your monocytes, eosinophils, basophils, all of those, and as well as your platelets, are going to be associated with your myeloid stem cell. Let's take a look at the picture, guys. I don't need you to know all the details. What I do want you guys to know is this. You start with a blood stem cell. They have two different types now, myeloid stem cell and lymphoid stem cell. Lymphoid stem cells only produce your B cells and T cells. Now again, if I want to produce red blood cells, if I want to produce eosinophils, basophils, and neutrophils, monocytes or platelets, it doesn't matter. All the other categories originate from the myeloid stem cell. Now, the last part of your Buffy coat, which was again that thin layer within our blood, we talked about the white blood cells. So the last part would be your platelets, which are also known as thrombocytes. These platelets are actually not a full-size cells. They are breaking off from a much larger cells called megakaryocytes. And you can actually see them. If I move forward, you can see that these cells are much larger than your typical cells. So this is a megakaryocytes, and these are your typical blood cells, right? So they are much larger. But what happens is this much larger cell literally fragments to little pieces to form your platelets. Now, what is the main function of the platelets? They are responsible for blood clotting formation or blood clot formation. I don't expect you guys to know this detail since this is the anatomy class. However, because I keep getting questions about it, I have introduced the concept here for you. The only thing I need you guys to know is that when we talk about blood clotting, other than platelets, you also need fibrinogen, which was a blood plasma protein. So that's something else you guys can review back and kind of backtrack to see what that was exactly. Now, looking at some of the disorders of the blood, again, these are only a few of them. There is, of course, a lot more detail about this when you go to physiology. So some of the disorders is polycythemia, which basically means that the number of your red blood cells are excessively high. Opposite of polycythemia is anemia. When your red blood cell count drops significantly, which has symptoms like you being tired continuously, your body feels cold, you're short of breath, etc. And one type of anemia that you may have heard of is sickle cell anemia, which is depicted in terms of red blood cell shape on a picture. So normal red blood cells, we looked at it, was kind of that donut-shaped structure, versus when you have a sickle cell anemia, the shape of your red blood cells are sickle-shaped or half moons. The main reason that happens is because there is defective hemoglobin proteins. Sickle cell anemia is identified as an inherited condition, which means it basically gets passed down from generation to generation. The only way that you can literally treat this is by getting blood transfusion. So you really can fix it, but because basically these misshapen cells are going to be destroyed at a faster rate. You need to basically get new healthy red blood cells through blood transfusion to make sure you don't end up with really low red blood cell count. One of the main disorders associated with white blood cells, and again, this is just really simplified versions, is leukemia, because basically you hear this unfortunately a lot. This is a form of cancer associated with your white blood cells. And you could basically classify them as, are they coming from the lymphoid stem cells? Then they will be lymphoblastic. Or are they targeting your myeloid stem cells? Then they would be myeloblastic. And then if you have a disorder in terms of your platelets, one of the most common one that you hear is when you have low red blood cell count, called the condition called thrombocytopenia, which basically means, again, low count of low count of platelets. And these individuals typically will have a hard time stopping a bleed because of the low platelet counts. Okay, let's skip this slide. The next concept I'm going to talk about is your blood vessels. Again, this is relatively simple. I'm not going to go into too much detail about it because of our time limitation, but we will highlight some of the essential components, which was also going to be reviewed in your cardiovascular system. So there are three main categories of blood vessels. You probably have heard of them: arteries, veins, and capillaries. Now, the way we define arteries is not based on the color, and I put that in quote unquote, because a lot of people say, oh, it's red, so it's an artery. If it's blue, it's a vein. It is true for most blood vessels, but of course, it's not going to apply to everything. And again, you'll understand this more in detail when we talk about cardiovascular system. But the way we define the arteries versus veins is the direction they move the blood in relation to heart. So if they're moving blood away from the heart, they're identified as arteries. And they're moving the blood toward your heart, they're identified as veins. If they are blood vessels that are essential in terms of gas exchange, that is, these are the locations where oxygen and carbon dioxide can be exchanged from your blood vessels. It is the location where nutrients can basically get into your tissue. Again, any waste product can be picked up from your tissue. That's what we identify as capillaries. Again, I'm going to go into a little more detail in just a minute. Now, when we look at a blood vessel, we have three layers within the blood vessels. The names are pretty simple and easy to understand. The layer or tunic starts with the most internal layer called tunica intima, which is, again, the most internal one, and is typically a simple squamous epithelium. The second layer is called tunica media, and it contains, one of the main characteristics, it contains a sheath of smooth muscle that allows vasoconstriction and vasodilation. And the outermost layer is called tunica externa, and it's typically connective tissue. The center where your blood passes through is referred to as the lumen. Now, what are the classification of arteries? Again, think about arteries and any blood vessel that takes blood away from the heart. So the first blood vessel categories is elastic arteries. Elastic arteries are basically the largest arteries you have in the body. And again, these are called elastic because they have a high concentration of elastin, which helps your body maintain blood pressure. The main blood vessel we have is that identify as elastic artery is aorta, which comes off of your left ventricle, and the main branches coming off of the aorta, like your subclavian, your brachiocephalic, your carotid artery, etc. Muscular or distributing arteries is when elastic starts to branch. So if you continue branching your elastic arteries, you form a smaller blood vessels that are identified again as muscular or distributing arteries. They are distal to the elastic arteries, as in they sit right after it. And typical blood vessels that we have names for are identified as your muscular or distributing arteries. Now, as arteries start to continue branching, they become smaller and smaller in diameter, forming blood vessels called arterioles. Again, arterioles are basically means a smaller arteries. They are larger than, they are, I guess, they will branch into capillaries in the next step, but again, they are much smaller in diameter as we go through the body. One of the main characteristics that arterioles have is that they are under the control of your nervous system. So basically, they can also contain, carry vasodilation, vasoconstriction based on your nervous system. Capillaries are the smallest blood vessels in terms of diameters. So here depicted in the picture is one single capillary network. And you notice that it is small enough that it forces the red blood cells to line up one at a time. It is extremely important in terms of, again, allowing gas exchange and nutrient exchange, or gas exchange and providing nutrients for your tissue. Interestingly, tendons and ligaments are poorly vascularized. So it means if they are damaged, it takes them a long time to heal because of lack of accessibility to nutrients and oxygen. And tissues like epithelial or cartilage are identified as avascular, and they rely on diffusion process to receive the nutrients and oxygen from relatively close tissues to them. Blood-brain barrier, I'm not going to go into details about this. We will hit on this again in the nervous system. I just wanted to make sure you guys understand that the capillaries throughout your bodies are not always permeable. Two main locations that you can see a barrier between your blood and the organ is your brain, and the other place is in the male reproductive system. So you have blood-brain barrier and blood-testis barrier. So again, the main reason is that you don't necessarily want to expose these essential components of the body to something that could harm you, basically, as it circulates through the bloodstream. So not everything that's in your blood is healthy and good, and you don't necessarily want your brain to be affected by that. So you basically form a barrier between the capillary networks and your neurons or your nerve cells to make sure that nothing harmful can pass through these capillaries and damage your tissue. Now, these barriers are, again, against a lot of the components. However, they are molecules that can pass through this. For instance, your typical gases, which is oxygen, carbon dioxide, as well as some of the anesthesia or anesthetic medication. Again, if they couldn't pass through it, they wouldn't be able to knock you out. Now, as we pick up the blood vessels, as we pick up basically your blood from the tissues, they empty into another class of blood vessels. These are your veins. Understand that, again, now this blood has been basically had its gas exchange, so it's ready to go back to your heart. And again, classification of veins is based on the fact that they move blood back toward the heart. So if you compare the blood pressure in the veins versus arteries, they are much lower than your arteries because they are farther away from the heart. The smallest veins that collect blood from your capillary network are referred to as the venules. And venules are, again, about 88 to 100 micrometers in diameters. And the smallest versions of the venules are called post-capillary venules, which are basically directly connects to your capillary network. Now, as these venules join each other, they form veins, and veins become larger and larger until they form two main veins, superior and inferior vena cava, that return blood to the right-hand side of the heart. And if they talk about veins associated with the left-hand side, that would be your left and right pulmonary veins. Their external, tunica externa, which is the outermost layer of the blood vessels, are relatively thick compared to what you will see in arteries. Lastly, when we look at your veins, as I mentioned earlier, their pressure is relatively low because, again, they're moved farthest away from the heart. So how do I ensure that the blood is effectively circulate back toward the heart and be able to basically continue its movement through the circulatory system? Those couple facts is going to help that process. First, if you compare the lumen of the arteries versus veins, the lumen of the veins are larger, which allows for an easier flow of blood. You also have valves positioned throughout your blood vessels, or more specifically your veins. So these valves are depicted right here, right here. You also have surrounding your blood vessels, you have arterial pumps. Basically, they bundle with the artery. So every time your artery pulsates, it pushes on the vein and allowing the blood to move. You also have a skeletal muscle pump, which basically means anytime you move your muscles, as these muscles basically contract, they squeeze the vein and allowing the blood to move. So kind of look at this picture, bringing these three concepts together. A skeletal muscle and arteries are going to put pressure on the vein. So vein basically going to be squeezed at one part, right? So it's going to allow the blood to move either up or down, right? Because you're kind of squeezing, let's say in this picture, at the center. So blood has two ways to go. It can go downward or upward, right? Now, if it goes downward, this valve is closed, right? The valve that's before the structure is closed, which means the blood cannot go down. The only option it has, it moves up. And again, as it moves up, the valve opens up, but if the blood wants to go back down, these valves close up and prevents the blood flow from going back. It is important to remember that when you sit down for a long period of time, it does have an effect on your venous circulation. And because, again, when you're sitting down, the skeletal muscle movements are limited, which makes it harder for the blood to circulate. So a lot of times, again, if you kind of think about people who may have had surgeries, a couple things that comes to mind is they wear those kind of compression socks that kind of squeezes their tissues and making sure that blood doesn't kind of stay in the lower limbs. They also forces individuals to start walking pretty early on. And again, by walking and any type of movement, your skeletal muscle pump is going to be active and allowing for a more effective circulation of blood. So that's about it. We will continue our next lecture with cardiovascular system.